The article we have written is a way for us to talk to frontline physicians, providers about how the mundane decisions we make every day have had really catastrophic impact on our lifelines in terms of medical supplies and leading to shortages. Hi, I'm Pratish Tosh, infectious diseases physician at Mayo Clinic and professor of medicine. We have published an article in the December edition of Mayo Clinic Proceedings entitled Supply Chain Shortages, We Are Part of the Problem and Solution. Often people will point fingers at greedy companies or governmental regulations and things like that, but rarely do we ever really examine our role as the purchaser, the provider, in creating the economic incentives that have led to the medical supply vulnerability that has resulted in so many shortages. Of course, we saw them trickle in here and there before the pandemic, but during the pandemic, things got really bad. The underlying vulnerabilities that were already there got exacerbated. And suddenly, things that we should get cheaply and easily suddenly were not available. And so what we delve into in this article is how, as healthcare providers, we're used to using what we use, but we also don't want to pay too much for something that seems too ordinary, right? We want to make sure we are spending our money wisely on innovation, staff salaries, these sorts of things, and so we got to cut costs somewhere. And the usual places, well, uh, our usual supplies, and so we just wanted cheaper supplies, and suppliers gave those to us. But what we didn't see in the background was what it took to make those supplies cheaper. And often that meant offshore sourcing, less resilient manufacturing processes, these sorts of things that got leaner and leaner and more vulnerable, such that small things, whether it's a blockage in the Suez Canal or a hurricane, far away, have really deleterious impact on healthcare in the United States. By focusing on price alone for decades, we have allowed the resilience of the supply chain to become, as I say, really more and more vulnerable. But there's a way to move this back towards resilience instead of vulnerability. And thankfully now we are really looking at standardized measures and metrics that can say what the resilience of a product is and are starting to show these vulnerability scores so the purchasers can make reasoned decisions when they're buying these products. And if you think about, if you buy something online, you don't just see the price. You see the price plus an aggregated a star rating, that which means product quality or customer service. But people don't go just on price alone. If you're buying online, if you see a product you want that has only 2 stars, but another product that may be slightly more expensive but still reasonably priced at that 4.5 or 5 stars, most people are going to go towards the 5-star product, even though it's more expensive upfront. And so what we are doing, and this includes a nonprofit organization of healthcare providers, organizations, as well as manufacturers and distributors called the Healthcare Industry Resilience Collaborative, or HIRC. What HIRC is doing is trying to move this back towards resilience instead of vulnerability by introducing a standardized metric, a measure of supply chain resilience for an individual product, and making that available transparently to the consumer. And there's a long way to go. But part of this is making sure that frontline providers, when they're asked, hey, which of these products do we want? Not just to instinctively go for the one that they're used to. maybe ask, how is the supply chain on this thing? Is this thing going to be there when I need it if there's a shortage or if there's some sort of, global supply chain issue? Instead of just instinctively going for the most familiar product. And if a supply is in shortage, asking, hey, why? And what could we have done ahead of time to have maybe purchased a product that was more resilient in how it's made? I hope you guys are able to read the article and get a sense of what this means for the individual provider.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.